Hi everyone, welcome back. As Utah transitions from a moderate risk or an orange phase on the state's health guidance system today, we asked Albert Marinez, Chief Analytics Officer from Intermountain Healthcare, to talk to us about what this means from Intermountain's perspective to ensure that we're ready to support our communities. Albert, thank you so much for joining us. We really appreciate your time.
Yeah, absolutely. It's my pleasure, Amanda.
So how has Intermountain been involved in our state's public health planning and readiness plan?
Yeah, for sure. It's a great question. And Intermountain has been working really closely with the Utah Department of Health, with the Utah Governor's Office, many valued healthcare colleagues across the state and community partners. I think it's really important for people to know that. And together we have been sharing models and we continuously monitor the situation for what may come next. We truly are in this together with our community partners.
I think a lot of people too are wondering what happens with COVID-19 here in Utah next. What is Intermountain doing to prepare? I know there are a lot of different models out there that people are seeing, and it can be a little bit confusing for people. So what should they believe is really going to happen?
Yeah, it's a question we get all the time. And I think it's important for people to know that our Intermountain infectious disease preventionists, our epidemiologists, our Intermountain analytic teams across the organization, they've been working really hard at this over the last several months, going through the planning, making and tweaking projections based on real validated research and real-time data. In fact, there are a number of generalized models out there, but our modeling is specific to the state of Utah and our Intermountain facilities. And for some of our physicians and analytic experts, this really represents the culmination of their career and experience, and it's something that we can really trust. We are really standing together, and we're prepared for whatever comes next.
I think the data piece of that is super important for people to understand that this isn't just based off of assumptions, but it's very much so based on data. We've also heard that the curve in Utah has flattened, but what's next? Do we know what type of future holds for the state of Utah?
Yeah, that's great. Well, no one knows what's going to happen in the future, although I wish I had that crystal ball like everyone. It really depends on all of us working together to make an impact. But we are now at a point of transition. The curve has flattened here in Utah, and that's been based on bold and sustained action to stay at home and limit business activity to essential services and practice social distancing. In fact, our educational campaigns and support from all of our community have helped strengthen those efforts. Now, because of those efforts, our state and our communities can move forward cautiously to open the economy and to begin loosening some of those restrictions. Now, it's important to understand that our models are not predictions. Instead, they're actually planning scenarios, and they're based on a series of assumptions that have been validated by research, and they're enhanced by our Intermountain analytics teams and our Intermountain clinical experience. So it's important for people to know that we're constantly monitoring the data for hotspots that may occur in the community, for an increase in cases or hospitalizations, and a myriad of other measurements. So while we don't know what the future holds, we are doing everything we can to stay prepared as we move forward.
And as we move forward, today is May 1st, so we're transitioning to that orange status as of today. How can we be confident that this is a safe approach?
Yeah, it's great. You asked really good questions, Amanda. We know that our efforts have flattened the curve here in Utah. And, whenever I've seen that data, I get excited. I think that's reason to celebrate. But it's really important that we're also careful as we're moving forward, because the extent to which our social distancing behaviors decline, we will see an increase in cases. So the need for constant vigilance has never been more important than right now. And I'll give you an example here. There is a 3-part trajectory of Utah's model that you have on your screen. And if you look at these different curves, I'll look at that bottom curve. It's in red right now, and it's showing a decline. And that's really good news. That actually represents a transmission rate less than 1, meaning for each person that gets infected, less than one other person will be infected. And that's really good. If you look at the black line, so the line all the way at the top that's just going up like a hockey stick, that represents unmitigated growth, meaning that we are just going through and going back to how things were before, not practicing social distancing, and that goes up really quickly. And that middle line represents a transmission rate of 1.2. And what's really interesting to me is the difference between just a 0.3 transmission rate makes a big difference in that yellow curve. We think it will actually be somewhere between that red and that yellow line. And so this demonstrates for us why it's really important, and it's dependent on all of us to make sure that we're doing our part to stay safe and contain the spread.
That number is really interesting to hear, that it's not this giant number that makes such a big difference between those different projections. And I think that's important for people to know. Can anyone get their eyes on this data that you guys have collected and put together?
Yeah, Intermountain wants to make this open for everyone in our community. So we're working towards sharing the model on our website so others can track the progress that we've been having in real time right along with us. I feel like it's really important for others to see accurately the data so we can understand why it's so important to remain vigilant and how our actions can actually impact our neighbors, our family, and our friends. So I'm really excited about being able to move forward to that and being able to educate the public as well with the data we see.
That will be a great resource for people to have, and I'm excited to see real-time data that comes from a reliable source. So what happens if people just disregard a lot of these practices, social distancing, wearing a mask, being vigilant in hand hygiene, and making sure that you're doing your best to stay healthy? Could we see a surge?
Yeah, let's not do that. We would absolutely. And again, we don't know exactly what the future holds, and I think that's important. But what we do know is social distancing is the number one factor in helping us flatten that curve, and we've seen it in actual data how that's really flattened the curve. So as we continuously monitor and stay ready, we will adapt for whatever comes our way, but we want to make sure that people stay really vigilant as we're moving forward. We're prepared for a surge if it comes, but we hope with the steps that we take today, we don't have to realize one.
Albert, what are your final thoughts for our viewers about what's going on with the surge and this transition to the moderate risk that we're in now with Utah?
At Intermountain Healthcare, we stand ready for whatever comes. Our approach has been to be flexible as COVID-19 unfolds in our communities, and we're planning for and will be prepared for the worst. But we are definitely hoping for the best, just along with everyone else in our community. I think that the way we're moving forward is really important. We're moving forward in a gradual and phased approach. The public health restrictions and guidance, they're not lifting all at once. And that allows us to safely support economic recovery while also maintaining extreme precautions and health standards. So social distancing is going to continue to be really important as we're moving forward. We need to remember we really are in this together, and the more we move forward with relying on each other to contain or continue those social distancing practices, the more we'll be able to contain the spread and get through this together.
Well, Albert, thank you so much for joining us. Your insight was really great, and I hope to see that data out there soon for people to look at. And if you guys have any questions about COVID-19 or have mild to moderate symptoms and would like to get tested, you can call our COVID-19 hotline at 844-442-5224. We also have an emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m., and that can be reached at 833-442-2211. You can also check out any up-to-date information on our website website at intermountainhealthcare.org. There's a link for the COVID-19 webpage just right on that homepage. Thanks, everyone. We'll talk to you next time.